Hi, everyone. My name is Dr. Crystal Aguh. I am an associate professor of dermatology and director of the ethnic skin program at Johns Hopkins School of Medicine. And so today I wanted to talk to you about melanoma and brown skin. So I think that it's so important when we talk about melanoma and brown skin to really open up with a discussion of Bob Marley, because if people are familiar with melanoma and brown skin, it's often because they have heard about Bob Marley. And he was very unfortunately diagnosed with melanoma under the toenail at the age of 32, which is very, very young. And at the time of his initial diagnosis, it was suggested that he undergo a toe amputation, but due to religious beliefs, conservative management was opted for instead. He was able to survive for 4 years after his initial melanoma diagnosis, but unfortunately, he succumbed to metastatic disease at the age of only 36 years old in 1981. And so I think that this is really an important opportunity to highlight the role of melanoma in brown skin and how dangerous it can be to people of all skin tones. And so let's talk about some general melanoma statistics. So melanoma, as many of you may know, is the deadliest form of skin cancer, and it's the third most common form of skin cancer overall, behind basal cell carcinoma and squamous cell carcinoma. It's more common in those who are fair skinned. And in this population in particular, there is a documented, well described relationship between high levels of sun exposure and risk of melanoma. And so when I talk about high levels of sun exposure, I'm talking about a history of blistering sunburns, tanning bed use, etc. There's also increased risk in people who have a family history of melanoma, as well as those who have fair skin, light eyes, and red hair in particular. So when it comes to melanoma, we often talk about these A, B, C, D, E's of melanoma, and we're referring to A, asymmetry of a mole, B, abnormal border. So if you have like a really fuzzy border with jagged edges that you appreciate in a mole with multiple colors is slightly unusual. A mole with a large diameter, so greater than 5 or 6 millimeters in size, can be concerning, and a mole that is evolving or changing. But what does that mean for melanoma in more pigmented skin types? So we know that melanoma occurs most commonly in those who are of Caucasian descent. That's about 45 cases per 100,000 people. And it's much less common in people with more deeply pigmented skin tones, like those of Hispanic, Asian, or African descent. However, despite this decreased prevalence, we actually see lower overall survival rates in those with brown skin, noting the widest disparities, particularly in Black individuals. And we think that might be due to the fact that melanoma is often caught at a later stage than when we see melanoma in fair skin. So you can see in this table here, all the way at the bottom, we see that about 11% of patients who present with melanoma will present with stage 4 disease, compared to only 4% of white patients. And we see similar numbers in an Asian population as well, so 10%. So we see that patients with more pigmented skin types are coming in later, and that may play a role into the differences that we see in overall survival. So what else is different about melanoma and brown skin? Well, while we most commonly see melanoma on the extremities and the trunk in people who are Caucasian, in brown skin, we see melanoma most commonly on the hands and feet. And so in this study, where they looked particularly at Black patients, they found that almost 60% of melanomas occurred on the lower limb and hip, and really a heavy majority of those are the hands and feet. So we already know that there are some biologic differences in melanoma. Certainly it's distributed on the body in a different way than we are more classically used to seeing it on Caucasian skin. So these are the various types of melanoma. In the first picture here, you can see a melanoma of the nail unit. That is a more common subtype that we see in brown skin. And so I'm going to focus on these melanomas today, but some of these other melanomas, like nodular melanoma, which is the second image, superficial spreading on the body, which is the third image, and uveal melanoma do not occur more commonly in brown skin and are more common in fair-skinned individuals. So the type I want to focus on today is something called acral melanoma. And the term acral refers to anything that's on the hands and feet. So acral melanoma is kind of an umbrella term. So when people have acral melanoma, they may not have a melanoma in the exact same site. So you could have it on the sole, as I have in this upper picture here, where this patient has a very large dark patch that's starting to fissure and is likely very painful. But you can also have melanoma of the nail. And you can see in that bottom image, there's a dark black line that extends all the way from the nail itself to the skin fold. And you can see that the nail is starting to break apart, and we call that nail dystrophy. And that's a very concerning sign that instead of seeing a normal mole, we're seeing a cancerous mole. And so these are some of the telltale signs. So a mole that's painful, growing, extending from the nail unit all the way to the skin can be a sign of potential malignancy. So what about a normal mole of the nail? This can be really tough, right? I can imagine that you could see this picture here and see the picture before it and say, okay, well, what's so different? I mean, they both look really, really dark. And it can be really difficult to tell, but there is a mole version of nail melanoma, and it's actually very common in patients with pigmented skin. Up to 100% of Black patients will eventually develop this nail mole, which is called longitudinal melanonychia. But they're usually a little bit thinner. Sometimes they can happen after trauma or pregnancy. But remember, because it's so common, it can be very difficult to identify any cause whatsoever. And so we'll talk about some of these features that could really be a sense that your nail mole could be melanoma. So there's this whole A, B, C, D, E, F of nail melanoma. And unlike the A, B, C, D, E's that we talk about on the skin, the A here stands for two things: age. So typically nail melanomas happen between the 5th and 7th decades. And there's certain racial groups that have an increased risk of nail melanoma. So African American, Native American, and Asian. And so that's the A in the ABCDF. The B also refers to two different things. It can refer to either the pigment, whether it's really, really dark and it's greater than 3 millimeters here, but remember, it can be up to 5 millimeters and still be normal. And it has a blurred or irregular border. Okay, so the same thing that we mentioned about the mole, if we're seeing a jagged border in the nail, that can be concerning. The C refers to a rapid change in size. Now, when you first see a nail mole or a nail freckle, which can look very similar, we do anticipate some slow growth over time as it reaches its kind of, final size. But if you're noticing, a doubling in size in just a couple of months, that is a reason to see your dermatologist. And then also, if you notice that the nail is starting to break apart, it's brittle, and it's breaking exactly where that pigment is, and you've tried other things, like you've tried antifungal treatment and it's not getting better, that could also be a concerning sign. The D is super important. So remember, up to 100% of pigmented individuals could have a normal nail mole or nail freckle, but typically we see multiple fingers that have involvement. So if you have a freckle on your on 3 or 4 nails, that's more reassuring than if you just notice a line in one nail. And actually, the thumb is the most common location to get a nail melanoma, followed by the big toe. So we tend to be a little bit more concerned about dark changing moles on one of those 2 digits than if someone presents and they have 6 fingers that have pigment in their nails. Again, I referred to this extension of the pigment from the nail itself to the skin. We call that the Hutchinson sign. So if the pigment is leaving your nail and hitting your skin, you should get that evaluated. And finally, a family history of melanoma. This stays the same regardless of your racial or ethnic background. If someone in your family has melanoma, especially a first-degree relative, your chances of melanoma are increased, and you should make sure that you are plugged in with a with a dermatologist that you see on a regular basis. So how do we prevent this, right? So we've talked about a lot of scary data, and we've talked about the fact that um, uh, Asian and African patients are more likely to have poor overall outcomes with melanoma. Is there a way to prevent it? Well, one thing that is not clear is the role of sunscreen in preventing skin cancer in brown skin. And certainly because we're looking for better options of prevention, it's important to look into sunscreen, and sunscreen is great. We know that regardless of who you are, sunscreen is going to protect you from sun damage. It's going to protect you from skin aging. And if you have skin discoloration, which is a big issue in brown skin, it's really going to protect you from that, and make sure that that does not get worse. Unfortunately, there's no data to suggest that sunscreen can prevent against acromelanomas, which kind of makes sense because these melanomas happen in locations that are particularly protected from sun exposure. So if you think about a melanoma on the bottom of your foot, that's not a place that's getting a lot of sun exposure. So for that reason, we don't think that sun exposure is directly related to these types of skin cancers. And as a result, sunscreen is unlikely to prevent the development of skin cancers in brown skin. So what can you do at home? Well, it's really important to perform a self-skin examination. I recommend performing these monthly or every 3 months or so that you can identify any new or changing moles. And you really want to be thorough about this, right? So these are places that you might not look at routinely. So the bottom of your foot, the top and side of each foot, in between your toes, as well as your toenails. And if you need a mirror, use a mirror, right? So that you can really get a good look at the bottom of your foot. If you're someone who likes to get pedicures often, ask your nail technician, hey, do you see anything that looks funny? And if they do, go and see a dermatologist. We're really always happy to help reassure you if necessary. And certainly if a biopsy is required, that can be done in a very straightforward manner. So I like to end by just talking about treatments. And I say this in light of kind of that first slide where I mentioned with Bob Marley. And it is important to know that early stage disease, especially if it involves the nail or the tips of your fingers or toes, is typically treated with a partial or full digit amputation. If it's on other areas of the hand or foot, like let's say the sole of your foot or the back of your hand, typically we do what we do for other melanomas, which is perform a wide local excision where we take out the skin cancer itself. And we also take out a large margin of what seems to be unaffected tissue because we really want to minimize the risk of recurrence. Because these areas are harder to close with kind of your classic typical stitches, sometimes skin grafts are required to close these sites. But overall, patients tend to tolerate these surgical procedures quite well. For more advanced diseases, immunotherapy like BRAF inhibitors, MEK inhibitors, and PD-1 inhibitors can be used, but we do know that unfortunately, response rates in acral melanomas are much lower with use of these medications than they are for classic melanoma. So that really underscores the importance of us conducting research and better understanding this disease process. So just some final takeaways. Despite poor outcomes, the good news is that overall rates of melanoma are quite low in patients with pigmented skin. And because they do grow very slowly over time, there is a lot of benefit of self-monitoring. If you have an understanding of what your moles are supposed to look like, you can pick up when there's any sense of change and have them evaluated by your board certified dermatologist. It's really important to understand your risk factors and what are signs of concern, because this could save your life or the life of a loved one. For more information on melanoma, you can visit the Melanoma Research Foundation and support any causes to help us better understand acral melanoma and melanoma in pigmented skin types so that we can improve overall survival rates for all patients. Thank you guys so much for listening. I hope this has been helpful to you, and I hope you have a great day. Bye.